Today I'm going to talk about the Support and Punish campaign, and you're going to hear a little bit about what it is, and then this evaluation that we organized thanks to the support of the Elton John AIDS Foundation, and then what are some of the recommendations and lessons that we took from that. And hopefully, yeah, we'll learn something about what we do in the next 11 years. So the campaign came about in, I think it started being conceived in 2011 with a meeting in Kiev, actually, and that meeting reunited networks of people who use drugs, networks of people living with HIV, and allies like IDPC, a big network that includes many of those networks. And I think it's fair to say that initially, this was a response to the disproportionate impact of the HIV epidemic on people who inject drugs. We wanted a campaign that tackled the disproportionate impact of the epidemic on our communities, and we quickly realized that the conditions that lead to that disproportion are at blame and not drug use itself. And what has been really interesting over the years with the campaign is that that sort of understanding of structural conditions being at the heart of this disproportion made it possible to then welcome many other grassroots organizations that they may not be particularly affected by the HIV epidemic and still suffer those conditions of violence and neglect that are enacted by the war on drugs. And so something that has been really beautiful to see with the campaign is this intersectional, not to sort of overuse the word, but intersectional organizing, like a recognition that these conditions affect us all. And so it's not just about one group or the other, but about abolishing those conditions in the first place in order to have futures where we can all live well and thrive. In terms of the core activities of the campaign, I can mention the Global Day of Action, which is the yearly high point of the campaign because historically it has been the UN Day against, I'm going to quote it because it's a heinous way of framing it, illicit drug abuse and illicit drug trafficking, and usually the celebration or the commemoration of that day by international agencies and governments is all about seizures and arrests and how many people have been, basically brutalized by the repressive apparatus of the state. And we thought it was important to reclaim that day to say, no, actually the approach that we want is one of care and dignity. We also have a photo project that it acts as a photo petition with more than 11,000 people already, and I have a booth upstairs in the 5th floor that you can attend and join it. In 2019, we added another rung to this ladder of engagement, which is the Initiatives Program, which provides $5,000 grants to organizations to do sort of longer work plans. Apart from that, of course, there's networking and skill sharing events, workshops, activities, and the idea of cultivating leadership within our movement. So like encouraging people who are taking the lead within their organizations to discuss between themselves, how do they do it and how do we make more of it. The evaluation itself followed a contribution analysis approach, recognizing that, of course, we cannot claim responsibility for changing any of what we're going to say because there's many things that have contributed to the change that we're going to discuss, but we can definitely pinpoint the participation of the campaign in achieving those goals. So in terms of what was the evidence reviewed, there was an expansive literature review, a review of feedback data from the last 5 years of the campaign, network mapping, seeing how different local partners connected with each other, a multilingual survey that was responded by 197 organizations from all over the world that have been part of the campaign, interviews with 14 campaigners, IDPC members of staff, UN official and donor representative, and 5 case studies resulting from interviews so that we could more in-depth, get more insights into what the change that we were noticing. In terms of findings, One is about involvement. The campaign started with started with 29 local partners and currently has about 198, sorry. And we saw this is an undercount because a lot of the times organizations at the national level will adopt sort of coordination responsibilities, which means that many other local partners are involved in sort of different parts of that particular country, but the response that we get is from the national organization that is doing sort of like that bridging. This is a wonderful map. The campaign has had activities take place in 126 countries. You can see how many times or how many years local partners have organized activities in this particular country. In half of the world, local partners have organized for more than 4 years. In a third of the world, local partners have organized for more than 8 years. In terms of reach, something that I was going to sort of highlight is that this is not just IDPC. We call ourselves a central hub, but there's many other hubs of the campaign. I was talking about national organizations that take on this responsibility, but also these thematic or regional organizations that they themselves take on the responsibility of fundraising, coordinating activities, identifying partners, encouraging mobilization in their countries. And something that is also worth noting is that although I've talked about the Global Day of Action and the Initiatives Program, there's also many organizations that will continue to carry this flag, this banner that we share transnationally throughout the year. We always say that the campaign is local partners, not necessarily just the hubs. In terms of the findings, one is about the importance of resourcing our movement, and that is both in many ways. So one is financially, because we provide these small grants plus the Initiatives Program, which means that we've been able to channel over $650,000 into our movement, which we're very fortunate to be in the position to do that. And partners really, as you see in that graph, appreciate the resources that both the central and the sister hubs are able to provide. There's also technical support, people writing to me asking, or writing to us asking, where can I find a quick explanation or a good explanation of naloxone in French? Where can I find a curriculum on prevention that is based on harm reduction and not prohibition? And if we don't have the answer, we have a network, IDPC of 198 members that can help us find the answer. And also the production of knowledge and advocacy resources. So we try every year to do a summary of what are some of the tactics and strategies that our local partners are using in order to advance the end of the world drugs, as well as recently, and I hope the printers can deliver as soon as possible because they're a bit delayed, but briefings translating sort of the gains that we've made at the international level and that can then be utilized at the national level to push for the reform that we want to see. And there's a little graph there about the Support and Punish grant spending. More concretely, 76% of survey respondents or local partners that responded to the survey believe the campaign contributed to tackling stigma, and that was mainly through storytelling and representation, humanizing people who use drugs, who usually tend to be presented in such demonized ways. The creation of safe spaces for communities themselves to organize, to discuss the challenges that they're experiencing, etc., and reaching out to communities of people who use drugs, whether, I don't know if somebody from ATS is in the room, but what they've done, for example, reaching out to street-based people who use drugs and then sort of like involving them in the movement. And there's that wonderful quote here by my lovely colleague from Schoon. Actually, I'm going to talk about that because in 2023, they decided that they would organize its social media campaign with notable or like known and also not people who have had experience with the repressive apparatus of the state and sort of telling their own stories in the first person and then using that as a way to start a conversation that humanizes people who use drugs from always an intersectional and very caring sort of perspective. Another one is about dialogue with decision makers. 72% of survey respondents believe that their way of campaigning had contributed to this, either through increased communication with policymakers or liaising with them about what was off in the way certain services were running. Being involved in advisory groups, like after sustained engagement, being recognized as a sort of reputable stakeholder that can sort of provide actually very valuable advice about what our communities need. Being invited in consultations in order to provide that technical advice, and thus encouraging decision makers to value the expertise of communities, and organizing trainings for each other and for policymakers to sort of, break down stigma and misunderstandings about who people who use drugs are. Although the idea comes to mind that, like, in Parliament in the UK, they tested all the bathroom stalls, and every single one of them had cocaine. So I think decision makers kind of have some idea. And as a case study, I'm highlighting IDU Care from the Philippines, an amazing community-led group founded, if I'm not wrong, during Duterte's awful regime that enacted a war on drugs that killed over 27,000 people. And Panky here is explaining how, they can engage with the government to point out what are some of the flaws, and of course learning how to navigate that lingo. And so IDU Care was invited to join a UN joint program on human rights with the Philippines, and they are part of it, and a report was produced recently that recommended a public health approach to drug policy. Another one is about changing narratives. 69% of survey respondents understood that their work contributed to this, either by improving media coverage or positioning narratives that are usually not the ones that media adopts, or slightly starting to change public opinion. But I put it in sort of question mark because survey respondents also identified how difficult it is to break, to completely change public opinion after being bombarded by war on drugs mentality for so long. And as a case study here, I'm identifying ATS in Colombia, who now very sort of insightfully say, now it's them who come to us in order to validate information. So they've become sort of unavoidable validators of information. And finally, 73% of survey respondents believe that it contributed to, their activities contributed to subverting punitive policies and practices. You see some of the ideas there, but I wanted to highlight our colleagues from the Zimbabwe Civil Liberties and Drug Network saying, the drug master plan is now reflecting the ideas of support and punish, including decriminalization and harm reduction. The last slide, I know I'm out of time. No, second to last slide, but I'm going to be, one is about growing the movement. It's really hard to stay on time. Fostering a sense of belonging and being part of the movement, and increasing the confidence of our campaigners to do the work that they need to do. Incredibly valuable. And finally, in terms of some of the lessons that we've learned, in terms of leadership, we were encouraged to make it a little bit more formal and organized. So now we have a leadership network of 24 representatives from all over the world that discuss what we do next. In terms of strategy, we've developed a new theory of change. In terms of communication, a new communication strategy. In terms of reporting, we're about to engage pro bono support in order to develop better reporting practices. And in terms of sustainability, thinking how we reach outside of the bubble and our usual donors in order to become more sustainable. Thank you so much, and apologies for the extra time.